I'm Olivia.
I'm Francesca.
Hi, I'm Nicole.
I'm Samuel.
We are the third year students. We're attending Ulster University School of Psychology.
This year we're on placement with Dr.Arthur from Yellow Ribbon Suicide Prevention Programme in Co Armagh Northern Ireland.
And today we're just going to give a short talk on suicide prevention.
Okay, so this presentation talks about suicide and suicidal behaviour. So mental health, what is it? Mental health is a level of psychological well-being, and it's related to your emotional and behavioural adjustments. There's about 450 million people worldwide that suffer from mental health. It's believed that it's the fourth leading cause of suicide. There's 1 in 4 families that has at least one member that suffers from mental illness. What is suicide? Suicide doesn't have an actual definition. However, it is known as deliberate self-harm to your own body. Now, mental health is not always the reason why people die by suicide. There's many other triggers that are linked to it. And around the UK, there's 5,668 people who have died. Who have died by suicide due to a mental illness. Now, 4,500 out of them were males. So there's a wee study that has been conducted by Benton et al., and it's looking at suicide within Northern Ireland across 7 years. It has shown that 50% of the actual sample have had prior suicidal attempts or thoughts. 82% were aged between 24 and 29, and 22% of the sample actually had mental illness. So now I'm going to pass you on to Francesca.
Hello, so I'm going to discuss the risk factors that associate with suicide. So there is no single reason why people take their own lives, as mental health it's a condition that can affect anyone in society, irrespective of age, gender, socio-economic background, or even your culture. So it's complex and multifaceted behaviour, and it comes from a lot of psychological, social, economic and cultural risk factors. So risk factors that can actually bring on suicidal behaviours include negative, stressful or traumatic life events. So an example of this would be, say, bereavement, the loss of a loved one. That can contribute towards suicidal thoughts. And self-harm, an example of this would be, say, cutting yourself. And it's a huge risk factor, it's a very complex behaviour, and also it's very dangerous. Physical health can also add to suicidal thoughts. So say if you had a recent diagnosis which you're not comfortable with. Other physical health conditions could be like a lack of safety in a construction site, or it can go along the lines of self-harm as well. So socio-economic disadvantage can also contribute to suicidal thoughts. Previous studies do show that areas with less advantaged areas, actually have a higher suicidal risk. So more risk factors would be addiction. An example of this would be social media addiction, which I'm sure everyone can relate to. Other ones would be substance and alcohol abuse. Feelings of hopelessness will also add to the risk of suicide, alongside burdensomeness and isolation. This can contribute to, say, feeling a lack of social connectedness to the rest of society or even with family. So cultural or religious beliefs could also contribute to suicidal thoughts or behaviours. And prior exposure to death and suicide. For example, if you have previous deaths in your family, you might find that an easier way would be to do the same thing or to be with them. And unwillingness to seek help because of the stigma attached to mental health is also a big contributor. So basically, as said previously, men don't really find it so easy to talk or seek for mental health, but it's easily done. I'm going to pass you on to Nicole now.
So I'm sort of leading on from Francesca there to sort of talk more about suicidal behaviours, how it feels, how to recognise it in yourself and others, and when it becomes a problem. So first of all, I'm going to talk about anger, which is a totally normal feeling, especially if it's in response to maybe feeling attacked or deceived. So how it feels could be tension of muscles, body temperature rising, almost feeling like guilty and easily irritated. These are all normal, but it only becomes a problem if you lose control of these emotions and you put yourself or others in danger. So what can you do? So if you feel someone is acting out this way, you can approach them but stay calm and listen intently to them. Give them space if they need it. Identify the triggers. So by simply talking to them and trying to sort of get to grips with why they're feeling this way and sort of be able to target that through that. And then again, help them to find help. Not everyone wants to just go and get help, so just try and help them to seek help. Next we have anxiety. So anxiety is feelings of worries or tension. Again, normal if exams, deadlines in work, pressures from bosses. So how does it feel? So it can affect your breathing. You can feel like you're unable to relax. You're constantly, maybe you can't sleep. You're losing sleep over it. A sense of dread, like you're maybe even waking up in the morning and you're having like even just dreading the day. And almost like a constant need for reassurance. So if you are worried about something, you constantly need to know that everything's going to be okay. Again, these can be normal if they're mild, but it does become a problem if you find that it's impacting your everyday life, that you can't function properly because this is the feelings of worry and dread are getting in the way of you enjoying everyday life. So that can be then related to if they're hard to control, if you feel like you're not in control of them. And then again, you start to avoid things that make you feel anxious, avoiding situations that would make you feel that way. So what to do? So try and understand and find out as much as you can. So again, it's all about talking. It's fine to talk, especially with someone you trust. And then again, if you think it's someone else, come and approach them and let them know that they can trust you to be able to open up and find out and just ask about their experiences. People might feel like they just need someone to talk to. If they just expressed how they feel, it can make such a big difference. And again, if you are going to approach someone and talk to them, always non-judgmental. It can really put people off coming to talk. And then ask how you can help. Some people don't like talking, so ask them how they feel they would like to be helped. Okay, so depression. Everyone can feel sad or tearful or upset over anything really. So it's a normal emotion. When it gets a bit sort of harder, it can be sort of feelings of worthlessness, guilt, and just being hard on yourself sort of in everyday life and everything that you do. And then again, when it gets to sort of like more extreme, you can sort of feel like less pleasure in things that used to make you sort of feel happy, which takes away then the happiness, and then the sort of sadness sets in. So when does it become a problem? So if these low moods and the pleasure has went so far away that it affects everyday life, you're just feeling miserable and you're experiencing these persistent feelings over and over and over again, to the point then to the other end of the extreme where you might actually begin to feel suicidal. So what to do? Obviously, if you begin to feel suicidal, this is a big issue. So you need to be open about depression. Let people know that it's okay to talk and be open about it. Keep in touch yourself with the person and tell them that you're there at the end of a phone call or a text. Don't be critical and encourage them to seek help. Okay, so self-harm. Francesca mentioned earlier it can be like a secretive behaviour, so it's not always obvious. So what helps for if you find that someone has confided in you and they have said, yes, I do self-harm, or you have seen the scars yourself? Again, no, don't be judgmental. Try to be empathetic. So to show empathy is to sort of try and feel, put yourself in their shoes to see how they would feel, and remind them of positive qualities, just to boost them and boost their morale, to let them know that it's not all negative, and encourage them to talk to someone. What doesn't help is trying to force change or label in the situation. Ignoring, it's sort of hard to confront someone with self-injury or self-harm, but totally ignoring it does not help at all, because a lot of people do want to talk, and then over-focusing can also lead to problems as well. So just a nice medium of just talking and letting the other person explain how they feel. Okay, so if you are worried about yourself or others, there's 3 points to consider. So what the person talks about, their behaviour and their mood. So if the person talks about feeling like taking their own life, if they talk about sort of feeling helpless or like they're like a burden, their behaviour, if they are isolating themselves from situations, maybe social situations that they always would have preferred to do, maybe not going for a drink after work, or anything like that, or even if there's an increase in alcohol or aggression, or maybe they're just completely tired all the time, and then their mood. So loss of interest again in things that they did enjoy, and almost like irritability. So what can you do? It's really simple. Grab a coffee, get a cup of tea, have a talk with someone who you think is feeling this way. And again, if you're feeling this way, it's the best thing is just to get a coffee and talk to someone you trust. So obviously talk in private, nice, secure place. Listen intently. Tell them that you care about them. Ask directly if they're having suicidal thoughts, which is a hard thing, but it's better just to be direct and open. Encourage them to seek help, but also avoid trying to explain to them the value of life. They do know the value of life, or minimising their problems or giving advice, because you're not trained to maybe give advice on something so serious that they're feeling. So you're better just encouraging them to get help. So now I'll lead you on to Samuel, who will tell you how to get help.
Alright, thank you, Nicole. So I'm just, bear with me for a couple more minutes. I'm just going to give a couple of more slides on groups most vulnerable. So I've seen that some of the things that we've seen is the social norm for everyone is suicide as a young person problem. But I got some research on that. The highest suicide rate in the UK is from 40 to 44 for men, and for women it's from 50 to 54. And that goes against everything that we've ever been told, or ever we think, because it's something that we just think, oh, this is young people's problem. Social media is having too much of a problem and letting them think that their lives aren't good enough. But it is affecting everyone around you. In England and across the UK, females have, and their suicide rates have got to the highest points over a decade now. This is 2 years in a row. This isn't just this year, but is last year as well. Suicide was seen as a young person's and a man's problem because men don't talk. But women are just as vulnerable to suicidal thoughts and pressures. The males' rates, though, consistently are higher across the UK than female. They're 5 times higher than in the Republic of Ireland and 3 times higher in the UK. So why are they the most vulnerable? So for men, I found research from some Ireland's report from men and suicide, why it's a social issue. Men compare themselves against the golden age, so against their fathers and grandfathers who didn't talk. They were the hardy men. They just liked to get on with their work. They didn't talk about feelings or anything like that. They were just seen as the hard men. But men do have feelings. They do get emotionally unstable at times and do get upset. And with the decline of traditional industries for males, it's becoming a lot more computer-aided work, so it's a lot less hands-on. You're not going to get stuck into a lot more jobs like what men is usually used to. So it's letting men become, they can't feel like they are a man, where they're getting stuck into a job, getting their hands dirty. But you can still feel like a man, just get stuck into the work no matter what it is. And I've seen as well, men in their midlife are becoming overwhelmingly dependent on their female partners. As much as we don't want to admit it, sometimes we can't live without our wife or partner, whatever it is. We grow to rely on them, we share with them every one of our problems, everything in our lives. And without them, it becomes a lot lonelier in our lives, and we struggle to deal with things on our own. But the good news is there is organisations there to help. And as it says, it is okay to talk. These organisations are trained. They have trained counsellors, psychologists, and they're 24/7 at the end of a phone call to help you at any time. It isn't a weakness to talk to people about their problems. It is more than a strength. To hide it under the carpet, as I would say, isn't the right way to go about it anymore. The thing we need to change now is to make people think that it's okay to talk about their problems. Make them think that we need to share more with others, not just keep everything to ourselves. So if you're going to take anything away from this talk, learn to talk to people, learn to share with others, and it's okay to do that.